It's my great pleasure to have with me Dr. Mark Goulston. Dr. Goulston has had an amazing career. He was a professor of psychiatry at UCLA for over 25 years with a special focus on suicide prevention. He's a former FBI and police hostage negotiation trainer. He's the pioneer of a therapeutic technique known as surgical empathy and the best-selling author of 9 books, including Just Listen and Get Out of Your Own Way, which we'll be talking about today. And he hosts his own successful podcast, My Wakeup Call, which I will link in the description below. Mark, welcome to Race Cogitons.
Well, it's good to be with you, and it's good to be with the USC community. But if this is a big hit, maybe it'll even cross over to UCLA. You just never know.
Yeah, I hope so. So I want to begin with a very simple question. What made you smile today?
Well, Adam knows what that's about. What made you smile today? I did a TEDx talk called What Made You Smile Today? Mm-hmm. And what made me smile today is actually speaking to you, Adam. And the reason for that is I'm told I look pretty good for a guy who's close to his mid-70s.
Oh, yeah.
And I'll share a USC story. One of my last mentors was a fellow named Warren Bennis. And people who have been at USC for a while will know the name. He taught for many years a course on leadership with Steve Sample. And I actually met him when I was a guest of one of the lecturers in that course. And we subsequently developed a mentor-mentee relationship. But I'll share something that in the last year of his life, he and I had a very good open relationship, and we talked about anything that was on our heart or on our minds. And he said to me, he said, "You know, Mark, I'm trying to be a good sport." And I said, "What do you mean?" He said, "They parade me around the Marshall School at USC, and they say he wrote all these books on leadership. And the students look at me and they smile politely, and they don't know who I am or any of my books." And he said, "It's painful when you get older and you've been seen as a so-called thought leader to be irrelevant." And he said, "I'm irrelevant. And I got to be relevant into my 80s, but it hurts. But I'm trying to be a good sport about it." But that really stuck with me. And because I'm in my 70s, and to me, the way to be relevant, and this is what I do now 100% of the time, is I meet with people 60 and under, and I help them distill what their future looks like and help them land in their future. And their future has to help the world. I'm not someone, if your future is, I want to make a lot of money and spend a lot of money, it's just not a good fit for me. But if it's for people who are touched by, especially the pain in the world, the anger in the world, the inequities in the world, and they want to do something about it, what helps me to be relevant is to help them land in a future where they make the world better.
Right, that's a great overview of your work, I would say. And I'm wondering how much of that came through your training as a psychiatrist and how much of it is kind of innate?
Well, I'll share a story because this may go out to university students who may be dealing with some challenges with COVID, and I'm quite open about this. So I've had 8 mentors, and my first mentor was the dean of students at my medical school. And what happened is I dropped out of medical school twice, and I think it was for untreated depression. And I took a leave of absence, came back. I was highlighting all my books, but I couldn't hold on to the information. And then I asked for a second leave of absence. So I had a meeting with the head of the school, the main dean, who's about raising money. And when a student takes a leave of absence, the school loses money because the tuition alone doesn't pay for what it takes to educate a student. So he sent a letter to the dean of students who cares more about students and less about money. And I think it was because the dean of the school was worried that when, after meeting with me, they told me that I was kicked out, that, you know, I might self-destruct. And I can understand that worry. And so I get a call from the dean of students, and he said, and he had a thick Irish Boston accent. This was back in Boston. He said, Mac, this is Mac. His name was William McNary, and we called him Mac. He said, Mac, this is Mac. Better get in here. I got a letter from the dean. So I go in there and I read the letter from the main dean, and it said that he had met with me. We talked about other professions, and he was asking the promotions committee that I be asked to withdraw, which is kind of a euphemism for kicking me out. So I wasn't flunking out. And I said to the dean of students, because I was at a low point, Adam, I said, "What does this mean?" And he said, "You've been kicked out." And I'm not a religious person, but something bordering on religious happened. When he said that, I kind of caved in a little bit. And I started touching my cheek and looking at my fingers because I thought I was bleeding. I just kept staring at my fingers. And it wasn't blood, of course, it was tears. And I basically cratered right there in front of the dean of students. And I will tell you, if he'd said, "If I can help you, give me a call," I might have left. I probably wouldn't have given him a call, and I'm not sure that I would be here today. But he didn't do that. What he did is he looked at me and he said, "Mark, you didn't mess up because you're passing everything, but you are messed up. But if you got unmessed up, I think the school would be glad they gave you a second chance." And so what I was experiencing, that raw vulnerability, started to turn to tears of relief that this fellow was being compassionate to me. And then he said, "Look at me." And he pointed his finger. He said, "And even if you don't get unmessed up, even if you don't become a doctor, even if you don't do anything with the rest of your life, I'd be proud to know you, because you have a streak of goodness in you. And we don't grade that in medical school. We should, but we don't. And you have no idea how much the world needs that goodness. And you're not going to know it till you're 35, but you've got to live till you're 35. And you deserve to be on this planet." And then he pointed, and I'm sobbing. And he points his finger at me and he says, "And you're going to let me help you." And so he arranged an appeal, and I met with the promotions committee. And I guess in some ways they picked up that I was messed up, but even some of they picked up that I had this kind of goodness in me. So I took another year off. And it was interesting. I grew up outside of Boston. I went to undergraduate school at UC Berkeley, and I was going to med school back at Boston. And I took this second year off, and I went to a place called the Meningers Foundation, which is a big psychiatric foundation hospital. And I think it's now centered in Texas, but way back then it was centered in Topeka, Kansas. And so I just wanted to get away from all the shoulds in my head, the West Coast, the East Coast telling me what I should do. And I went there and I took an elective, and I didn't even know what psychiatry was, but I would spend my time in the middle of winter going for walks with these schizophrenic farm boys. And I didn't know anything about farming, but I was able to connect with them.
So a psychiatric hospital is the last place I would think to seek relief, especially if you didn't already have an interest in psychiatry at that point. So how did you wind up there?
Well, I think somewhere in my head, I felt like, I don't know where I belong in the medical field. And again, I knew psychiatry had something to do with psychological pain. And I think I'd been on some rotations, where I saw that. So I probably related to it. So during that year, a part of the time, there was an elective being offered to medical students at Topeka State Hospital, which was part of the Menninger Foundation. So I figured, what the heck? And I went there. And it was really kind of interesting. This was, I think, in 1972. And this was during the oil embargo, in which the whole East Coast was shut down. And I remember driving my little Chevy Vega car across the George Washington Bridge. And I was the only car on the entire bridge because the country had shut down because there was this oil embargo. And then I arrived in Topeka, Kansas, and started working at Topeka State Hospital. But, and I remember asking psychiatrists to work there, is this really a legitimate specialty? They said, what do you mean? You know, I go out and I walk with some of these patients. We're walking in the middle of winter. There's snow outside. And it's different than the other medical specialties. And they said, no, it's truly legitimate. And you seem to have a knack. Now, having dropped out twice, I didn't think I had a knack at anything. And so I tucked that away, knowing that maybe there was something I could do in life. Mm-hmm. And so knowing that, I was able to come back, finish medical school, and then I did my psychiatry residency at UCLA. And I, at that point, I met another mentor named Dr. Ed Schneidman, who was a psychologist. And what Warren Bennis was to leadership, Dr. Schneidman was to suicide prevention. So he and I became close, and he started, when I finished training, he started referring me still suicidal psychiatric patients who needed to be discharged from the inpatient wards because they weren't acutely suicidal, but it was always a part of kind of their personality. And essentially, I just did with them what Dr. McNary, what Mac did for me. I just saw the goodness inside them, and I learned to listen into people's eyes. Mm-hmm. And I'm doing my best to teach the world, how do you listen into people's eyes? And what happens is we're afraid to listen into people's eyes if they're scared or angry or whatnot. There's something very primal. But I learned to just dive into their eyes as opposed to keeping a clipboard between them and me.
Right. Is this something that was uniquely learned in this clinical setting, or did you have a knack for doing that in your personal relationships, even leading up to this point?
Well, I think what happened is what that dean of students did for me. He looked into me, and basically saw my feeling hopeless, and he figuratively put his hand in there and said, "I'm not going to let go of you." Mm. But I did have a few incidents. So since you told me we have some time, and I might write this up somewhere, and I'll call it listening into minds, eyes, and souls. So when I was training as a medical student, but still I felt really like I didn't fit in. I couldn't really relate to the other students. I remember we were doing a rotation, a medical rotation at the Veterans Hospital in Boston. And I remember we were outside of a patient's room. I don't remember his name. We'll call him Mr. Smith. And when you do rounds, you have the resident, you have the intern, you have the medical student, you have the attending doctors, and some other specialties. And I remember we were outside Mr. Smith's or Mr. Jones' room, and they're all saying what they think Mr. Jones needs. He needs more chemo. He needs more tests. He needs surgery. And I'm just bouncing around because, again, even though I'm back, I'm still not functioning all that well. And then a nurse came over to our group assembled outside Mr. Jones' room, and she said, "Didn't you hear? Mr. Jones jumped from the roof last night. He's in the morgue." And so the group got totally quiet. And as loud as you're hearing my voice right now, I heard a voice that said, maybe he needed something else. Mm-hmm. And I think that was sort of the moment when I started to pivot towards psychiatry.
Right.
Then there was another incident. So that's listening into people's minds. Then there was another incident, and this was shortly after I'd finished my psychiatric training, and I was called up to do a consultation on the oncology unit with one of the early AIDS patients. And I don't even think AIDS was given a name at that point. This was this strange illness. And I was called up to meet with we'll call this person Mr. Jones. I'm probably mixing them up. And the doctor said, you need to go up and okay an order for soft restraints on his arms and legs because he's pulling at his IVs. He's pulling at the respirator tube that was in his throat. He's kicking and writhing in bed. And so you need to go up and okay an order that we gave for his arms and legs, and to okay an order for a antipsychotic medication so that he can calm down. And I walk into his room and his eyes are as big as saucers and he can't speak. He's going, I say, what is it? And he's going, and he's trying to tell me something. And I said, what is it? And then I put a pencil in one of his hands to see if he could write something down, but his hands were all tied down and he just scribbled and I couldn't make it out. And the other doctors said, look, he's just psychotic. Just tell him that we had to do this. And so I calmly look into his eyes the whole time. And I said, we had to put down your arms and your legs because you were pulling at your IVs, you were kicking, you were writhing all over the bed, you were pulling on your respirator tube, and and I'm giving you something to calm you down, and I'll be back. And when you calm down, we'll take you off everything. So a day later, I got paged by the doctors, and they said, Mr. Jones told us to page you. He's off the respirator. He's sitting up in bed. So I go to the bed. I go into the room, and he grabs onto my eyes. They're not wide like this. They're not like crazed. He grabs onto my eyes like I'm grabbing onto your eyes. And he says, pull up a chair. And he seats me with his eyes. And he just kept looking at me. And he said, what I was trying to tell you is that a piece of the respirator tubing was broken and stuck in my throat. And you do know that I will kill myself before I go through that again. Do you understand me? And he just held onto my eyes, and I teared up and I said, I'm so sorry. Yes, I understand. So that taught me that people are trying to communicate sometimes with their eyes, things that they can't put into words. And then I think the final thing that really turned the corner into and helped me to create this thing or invent this thing called surgical empathy is I was seeing a very suicidal patient as an outpatient, referred to me by Dr. Schneidman. She'd made 2 or 3 attempts before I'd seen her in the previous 3 years. She'd been in the hospital for a month and a half at a time. And back then you could go in for a month or a month and a half. And I didn't think I was helping her. We'll call her Nancy. That wasn't her name, but we'll call her that. And she would come in, she'd sit down. She wasn't catatonic, Andy, but she'd look at me like this. And one weekend I had been moonlighting at a local state hospital, Metropolitan State Hospital in Norwalk, California. And so it's Monday and I come in to see her and she's like this, and I'm sleep deprived. I don't think I slept for 24 hours, maybe 30 hours. And as I sit down with her, suddenly all the color in the room turns to black and white. So I'm looking out at her and the room is black and white, and I start to get the chills all through me. I mean, all through me. And I thought I was having a stroke or a seizure. Now, since I'm a medical doctor, I'm a psychiatrist, not a psychologist, I did a neurological exam on myself, and I'm going like this, and I'm looking at my eyes, I'm tapping my elbows, tapping my knees, and I realize I'm all here. I'm not having a stroke or a seizure. And then I had this crazy idea that I was looking out at the world through her eyes. Black and white and chilly. That's where she was emotionally. And because I was sleep deprived, I blurted something out that normally I wouldn't have. And I said, Nancy, I didn't know it was so bad, and I can't help you kill yourself. But if you do, I will still think well of you. And I'll miss you. and maybe I'll understand why you had to get out of the pain. And I thought, I just gave her permission to kill herself. I just blew it. And that was the first time she looked at me. I mean, she went kind of like this, and then she looked over, and then she looked, and then she grabbed onto my eyes. And she grabbed onto my eyes like Mr. Jones had.
Mm-hmm.
And I said, what are you thinking? And I thought she was going to say, thank you for understanding. I'm overdue. And I thought she was going to thank me for giving her permission to take her life. And she looked right through me. And she said, if you can really understand why I might have to kill myself to get out all this pain, maybe I won't need to. And she smiled. And then I reached out and I held onto her eyes. And I said, I'll tell you what we're going to do. I'm not going to give you all these treatments, the medications, and all these things you've been tried on, unless you say, maybe we should try something else. Because you've been tried on this stuff. You've been going through this for years. And I'm not going to give you any of that unless you ask for it. Would that be okay? And I kept looking at her eyes. And there was a look like, yeah, keep talking. And then I reached in and I held onto her eyes. And I said, what I'm going to do instead is I'm going to find you wherever you are. And I'm going to keep you company there. Because you've been there alone too long. Would that be okay? And then she started to tear up. The color in the room came back. The chills went away. And then she began to come back. So that's a taste of surgical empathy, and something that I've learned, and I know this has taken the interview in a dark place, but if you've ever been suicidal and it just doesn't go away, death is compassionate to feeling hopeless that won't go away. But what I want to tell you, if you're listening in and you can relate to that, the hopelessness will go away. See, what I discovered and I've spoken about when I talk on suicide, I wrote a blog after Anthony Bourdain and Kate Spade died by suicide and have 500,000 views in a week. And I said, why people kill themselves, it's not depression. Now, that's not exactly true. Depression, all these treatable things do contribute to it. But there's many people who are depressed who are not suicidal. Many people who lose their job, get kicked out of school, lose their marriage, and they're not suicidal. So it can contribute to it. But one of the things I realized that all suicidal patients have in common is they feel despair. And if you break the word despair into DESPAIR, it means unpaired with reasons to live, hopeless, helpless, powerless, worthless, useless, meaningless, purposeless, and when they all line up, pointless. And that pain that won't go away, what happens is death pairs with you to take the pain away. But if someone else can pair with you and feel your feelings with you, and you don't feel so alone, you will let go, not always, but you will let go of death as the only way to relieve your pain, and you will grab onto what I'm calling the surgical empathy, feeling felt. So I've gone on and on, Adam. I'm glad that you haven't checked out or fallen asleep, but you want to weigh in now? Because that was more of an introduction than you expected.
I'm listening intently. These stories are, well, both profound and chilling. Now, when you use this technique of surgical empathy, it seems like you're taking on the burden of their pain. And over decades and decades of doing that, how do you stay sane yourself?
Well, what I've discovered is when you take on their pain with them and you see in their eyes the relief it gives them and the hope, what happens is I feel profound sadness because I'm feeling their feelings, But when they feel less alone, when you're not keeping a barrier between you and them as the professional, well, we can try this and we can try that. And again, I'm not putting any of that down. I'm just saying that there are some people who have been suicidal for a long time, and maybe what they need is for someone to connect with them in those feelings by feeling it with them. So you're right. If that's all I felt, it could bring me down.
Mm-hmm.
But as I said, when I would see people starting to feel relief. So actually, I do a program. A friend of mine reached out to me because his 14-year-old son died by suicide 3 years ago. And he reached out to me after that. And if you go to teen mental health webinar video, teen mental health webinar, you'll see Jason Reed's 9-minute video to about a dozen male entrepreneurs. And Jason is an entrepreneur. And he basically talks about how he felt it was his fault that his son died by suicide, because as he said to these male entrepreneurs, he said, I'm an entrepreneur. I don't share my failures with my family. I'm the man. And I solve things. I give solutions. But in essence, what he discovered is that he made it impossible for his son to open up to him. Because whenever his son would open up to him, he would throw a solution. Well, you could try this or you could try that. And after his son died, they found 2 suicide notes. One was the passcodes for his computer, and he'd been looking for ways to kill himself for 6 months. And then there was another note that said, "Tell my story." So if you go to Tell My Story Film, you'll see the documentary that Jason made, put, I think, over $250,000 of his own money in it. And he went up and down the West Coast talking to people who had been touched by suicide, who'd either tried to kill themselves or family members of people who had a completed suicide. I'm in the last 10 minutes of it. And so Jason and I now speak to organizations. We speak to an organization called EO, which is like a junior part of YPO. YPO is Young Presidents Organization. EO is Entrepreneurs Organization, and they're slightly younger. And we talk to those groups because, especially with COVID, there's lots of families worrying about their teenagers and young adults. I don't know if you heard it on the radio, but I heard that the statistic for teenage girls of increase in visits to emergency rooms during the COVID period for suicide thinking or suicide attempts, it's up 51%.
Mm-hmm. That's terrible, but I'm not too surprised given the isolation we've experienced in the last year. So there's 2 questions I have about this. One is from a more clinical perspective, and one is on the personal end. So first, I've heard from listening to some clinicians that the advice is to distance yourself from your patient emotionally. So you're helping them, but you're not feeling what they're feeling. But it sounds like with this surgical empathy technique of yours, if you're not feeling what they're feeling, you're not helping them. So what's the line between those two?
I think you have to figure it out. So let me ask you, Adam, have there been times in your life when you felt down or frustrated and people were giving you helpful advice, but when you were feeling down and frustrated and, let's say, stuck, you couldn't go to where they were at? You weren't being stubborn. There were great suggestions, but something inside you kept you locked inside, just like with Mr. Jones, the person on the respirator. He couldn't come to where I was. And nor could the original person whose mind I heard after he died, he couldn't come to all the doctors. And so this is not something to be taken on lightly, but I'll give you some tips because, and you can find these all over the internet. If you look up Mark Goulston suicide prevention, I've got tons of stuff out there. So for instance, here's another example of surgical empathy that parents can use with their teens that they're worried about, or young adults, or you can use with one of your friends. And there's actually 4 things that you ask a person. So when you're walking with them, and when I tell parents to use this with their teenagers, don't pull a heart-to-heart talk unless your teenager starts it. Teenagers hate heart-to-heart talks. And the reason for it is because when a parent pulls a heart-to-heart talk with a teenager, what the teenager is picking up is the anxiety of their parents. Yes, their parents are concerned, but they're also feeling like they're scaring their parents, which they are. Mm-hmm. So while you're doing an activity, try and squeeze this in. And especially you can even do it maybe when you're driving, because it's not eye to eye, you're next to each other. And here are the 4 things that you ask. You say, if I'm a parent, what I would say to my teenager that I'm worried about is to say, I hear all parents are worried about their teenagers. As a group, we're all worried because it's been this really weird year with COVID. Can I just ask you a few things? And hopefully they'll say, okay, whatever. You can say, at your absolute worst, how awful are you capable of feeling about your life or yourself? And they're going to go, what? Yeah, at its absolute most painful worst, how awful are you capable of feeling about your life, your future, yourself? And then if they say, pretty awful, what you want to do is surgical empathy, open up more. Pretty awful or very awful? And they're going to respond, okay, very awful. Then the second thing you say to them is, and when you're feeling that, how alone do you feel? And frequently they're going to say, pretty alone. And again, you want to open them up. That's the surgical empathy. You want to drain the abscess inside that hopelessness.
And how is this opening up different from forcing a heart-to-heart, which you said might only increase someone's anxiety?
Well, first of all, you're asking them questions in the middle of an activity. Again, face to face, they don't like, but you're framing it, saying a lot of us parents are worried about our kids, and because of COVID, and this may or may not have to do with you, but I know I can see that your life is different. You've been isolated. So can I just run some questions by you? So it's the framing it, which might get you permission.
Right.
But let me finish the 4th thing. So at your absolute worst, how awful are you capable of feeling about your life or yourself? If they let you in, they'll say pretty awful. You say pretty awful or very awful, very awful. How alone? And when you're feeling that way, how alone are you capable of feeling? Pretty alone or all alone? Okay, all alone. Then the 3rd thing you say is, take me to the last time you felt that. And they're going to pull back. What? Was it 2:30 in the morning when we kind of heard you pacing around in your room in the middle of the night? Sounded like you couldn't sleep. But just take me to the last time you felt that. Why? Just tell me. Just describe it. Because see, when they can describe it so vividly that you as the parent or the friend can see it, they re-feel it. So when they say, yeah, I was up at 2:30 in the morning, I couldn't get back to sleep, I started pacing around my room. And then, and again, you don't get scared as the parent. You could say, and then what happened? Well, I just couldn't get back to sleep. I didn't know whether to hit the wall. I didn't know whether to throw something. I mean, I was just getting so frustrated. And then you're listening, I could say, that sounds awful. And then what happened? And then the sun rose. And I felt a little better. And then the final thing you say, but you don't rush them. You're trying to open this wound up. And then the final thing you say is, I have a favor to ask you. Whenever you're feeling that way, or even close to feeling that way, I want you to do whatever it takes to get your mom or dad or my undivided attention. Because there's nothing more important to us than you not going through that alone. And we have so many things that we're dealing with It's sometimes tough to get our undivided attention, but I need your help with this. I need you to do whatever it takes. Maybe it's just signaling your mom, your dad, or me and saying, remember that thing we talked about? I'm there again. Now, this will take some practice, but can you track with me, Andy, how that in many ways that can open things up? One of the things that Jason told me, which I found very poignant, he said, when you ask your kid, how you doing? And they say, great, they're usually good. But when they say, I'm fine, I'm good, they're usually not.
Mm-hmm.
What they're usually saying is, I don't want to talk about it, leave me alone.
Right. So is it knowing that there's a listener there that encourages the opening up? Like, what if you try all these techniques and someone is still unwilling to open up?
And you're going to run into that a fair amount of the time.
Mm-hmm.
What I would suggest you're saying is, I know you don't want to open up. I know you feel that if you open up, it'll just make things worse. I know that you're worried that if you open up, you'll scare me or you'll be a burden. But what you need to know is if you open up, it might scare me, but you're never a burden.
Mm-hmm.
What burdens me is you're not opening up and knowing that you're in hell alone.
Right. Yeah, with that in mind, I think this might be a good segue to your book, and we could see it in the background there, Just Listen. So once you have someone communicating with you, and it doesn't have to be about serious topics like depression or even suicide, it can be just generally. Well, actually, first, I want to ask, what motivated you to write this book?
Well, I've co-authored 9 books.
Mm-hmm.
And Just Listen is somewhere in the middle. Actually, my first book was called Get Out of Your Own Way,
Mm-hmm.
which was written 25 years ago. And with no promotion, no book tour, no advertising, it made it onto the Wall Street Journal bestsellers list 2 weeks ago. I don't know how it made it there. Part of it was on sale on Kindle, but still a lot of books fantastic. On sale. And I actually have an audio course, which maybe you can put a link to at Himalaya.com
Sure.
/defeat. And if people put defeat in as the promo code, they can hear it for free. And there's other audio courses there, like with people like Seth Godin, Tim Ferriss, a bunch of other more notable people than me. But I think I wrote Just Listen because as I looked out in the world, I just saw people not listening to each other.
Mm-hmm.
And here's something kind of funny. It became the top book on listening in the world. It's in 27 languages. And I speak around the world on it, and I can't get arrested in America. Meaning I've spoken in Moscow twice, India 3 times, the UK, Canada, about listening. But Americans want to be listened to.
Mm-hmm.
I mean, it could be that we are one of the worst countries when it comes to listening to others. And so I wrote that because I just saw people going yada, yada, yada at each other. And I saw it coincided with people not becoming increasingly unhappy, agitated, impulsive, compulsive. And it just kept getting translated into more and more languages. But I'll share something. Here's where I am with it. I spoke in Moscow about a year and a half ago with the Nobel Prize winner. His name was Daniel Kahneman. He wrote something called Thinking Fast and Slow. Mm-hmm. And he has a new book out called Noise. But 5 of my 9 books are bestsellers in Russia. But what I focused on, and I'm going to demonstrate it with you and see if it changes something in your head and your body.
Hope so.
So we're going to do an experiment. So what I focused on is there was 1,000 Russian business people, managers, CEOs, and the talk was called Change Everything You Know About Communication. And I said to them, And there's a video up, there's a good video up on YouTube about this. Sorry for the sirens in the background there.
No worries.
But in what I said to them is, if I focus on you listening to me and I deliver a bunch of bullet points and I'm entertaining, you'll give me your mind for an hour and we will have a very nice transactional conversation. You'll write down the bullet points. You'll try some of them. Most of them won't work for you. And you'll think, well, they work for him. He's an expert. But I'll get away with it if I'm engaging and entertaining. And you'll give me your mind for an hour. And they're looking at me like I'm really flat out crazy.
You know, occasionally I notice this viewing listening as a or conversation as a transaction. Sometimes it's not even in whole conversations, it's moment to moment. Like something I've been trying to practice with this podcast is truly listening rather than listening enough so I can plan the next thing I want to say.
And so I'm going to teach you it right now in real time, because what I said to them is I said, if I focus on what you're listening to and deliver some bullet points, you'll give me your mind for an hour. And then I switched to sort of an NPR voice. And I said, but if instead of that, I focus on what you're listening for, and without you telling me what it is, I give you it, you'll give me everything. And I said, and I'm going to do this with you, because there's a part of you that's listening to me. But if I put on my focus on what is Andy listening for, tell me if I get it right. And if I do, if it changes something in you. Because if I'm you, Andy, I think what you're listening for is you're listening for something that will give value to your viewers and listeners. In fact, you're listening for information that will blow them away enough to tell their friends, I just heard a podcast. You got to listen to it. Here's the link. And you're listening for guests that give value, practical value, a value that your listeners can relate to. And you may be listening also for so-called experts who are just boring as all get out. They are just stiffs. And then you have to go back to them afterwards and say, I don't know that we can use the podcasts. You know, you might cover up and say, we ran into some difficulties. You want to do it over again. But what you're listening for is there may be some guests that you have to protect your listeners from because they offer no value. Well,
Fortunately, I haven't run into that problem. You know, I noticed you hosted Jordan Peterson on your podcast a few weeks ago, or maybe a couple months ago. And one of his rules in his books is, actually, I can't remember the rule, but the idea is treat everyone as if they can teach you something.
Mm-hmm.
And so is that a mindset that's been able to get you away from this, you know, viewing certain people as not being worth listening to?
I hadn't thought about that, but when you focus on what another person is listening for, mm-hmm. and you're just curious about it, they will pick up the different energy. You know, in fact, I've been recently doing presentations to accelerators with early startups about how to pitch to investors. And what I've said to them is, have you ever pitched your company to an investor and they smile and you think it's a yes? And they all raise their hand. And I said, is it a yes? And they say, no. So you thought when they smiled, they were going to say, when do we start? And they said, yes. And I say, how often do they say that? They said, never. I said, that's because investors don't smile. It's about money. They're smiling because they've already decided they're done with you and they don't want to be rude. And so what I've been coaching these startups with is when you get the smile that is really a no, what they're really telling you is that they listened for something and you didn't give it to them. And so I've been teaching them how to see that as a signal to switch the conversation and even say to that other person, when we started the conversation, we were kind of at an equal level. You had money to invest. I have a company that needs that money. And it's changed now. And I think it's changed into you have money to invest and I'm not a company that you invest in. And I think it's because you were listening for something and I missed it.
Mm-hmm.
With the time we have left, can you tell me what you were listening for? Now you have nothing to lose because you've already lost them anyway. But do you follow what I'm saying? And you can use this in other places. You can use this anywhere in your life. You can be in a conversation and it's going sideways and you can press pause and you can say, and it could be even an argument that's escalating. And you can say, wait, can we press pause? What? No, can we press pause for a second? What? I think our voices are escalating because when we started our conversation, you were listening for something and it didn't happen. In fact, I may have said the exact opposite, which wasn't my intention. I didn't go in here into this conversation thinking about how can I upset you. But when we started out, you were listening for something and I totally missed it. What were you listening for? Now, this takes practice, but are you getting kind of the vocabulary of it?
Yeah, I think so. So there's certainly a positive aspect that'll come from as you shift your own words to match what someone is listening for. That can do you both good. But then what about in cases where people are listening for, this happens a lot in politics. People are only listening for one thing and they're not willing to change their mind, whether or not they're right about something. How do you deal with that then?
Well, it's interesting because as we're recording this, I don't know when it'll go up, but our current president is trying to move America onto the world stage and deal with certain relationships with our allies and with our adversaries. Mm-hmm. And I'll just share something because what's upcoming, and again, by the time this posts, it will have been done. What's upcoming is there's going to be an interview with Vladimir Putin, and I've been seeing some previews. And he deflects. You ask him a question, he deflects. So if I was an interviewer, something that I would do, and it could backfire. I mean, Putin's pretty smart. I would say, we're talking about something. I asked you a question that I was looking for an answer for, and I can see you change the subject, and I'm willing for you to change the subject if you would simply say, I'd prefer to not answer your question. I had a question that started this paragraph, and now we're talking about something else, and I'd be happy to switch to whatever you're talking about if you would just let me know that you'd prefer to not talk about it. That's your right. You don't have to talk about everything I ask you about, but I need to get complete with that question. Otherwise, it just looks like you're jumping around. I don't know what he would do, but if you can stay calm, as opposed to what seems to happen is I think people have low expectations of politicians who are always deflecting. Mm-hmm. And if I was a reporter, I'm there asking you not my questions. I'm asking you questions that my viewers want answers to. I am on assignment to ask you the questions that are on our viewers and our readers' minds. And you have the right to say, I'd rather not answer that question, or I prefer not to answer that question. And then I'd be happy to switch to something else. But at least on the record, I asked you and you addressed it by saying you preferred to not answer it. Now, of course, that's going to get awkward for the politician, because if they say, I'd rather not, I'd prefer not to, then of course it implies they're hiding something. But if you can stay true as the reporter there, I'm here to ask you certain questions because these are the questions that are on the minds of our viewers and our readers. And you can certainly not answer any of them, but just tell me you'd prefer to not answer it. That's your right.
Mm-hmm. Yeah, that's a great point. So with the remainder of our time, I'd like to talk about your book, Get Out of Your Own Way, which talks about overcoming self-defeating behaviors, and your advice for especially young people dealing with this. But so first, why are we so prone to self-defeating behavior, whether that's just procrastination or laziness or anything like that?
Well, all self-defeating behavior makes us feel better for the moment. In fact, something I'm going to put up here is that's a URL that'll just take you to my website, and I keep permanently pinned as the top blog something about the course, Defeating Self-Defeat at Himalaya. So if you take your camera and you scan that, it'll take you to my website to that, and then you can see that as the first blog.
Mm-hmm.
But all self-defeating behavior makes us feel better for the moment, because when we feel stress, we often want to do anything that releases the stress. The problem is if we do anything to cope with the stress and we don't deal with it, it's still going to be there to deal with. Mm-hmm. And what I talk about in Get Out of Your Own Way, and there's 43 to 4 page chapters, is different ways of looking at things. So for instance, in the chapter on procrastination, and this is one of the episodes at the Himalaya course, I say we procrastinate not because we're disorganized or lazy, but because we're lonely. And my evidence for that is that there's a huge population of people who have trouble with alcohol, and they procrastinate giving it up until they have a fellowship, until they have a sponsor, until they have someone who is going to help them get through it, and they don't have to do it themselves. See, what happens with procrastination is when we were young and young children, we often had to do things that we didn't want to do, and it was painful, but we didn't have any choice. And we said to ourselves, when I grow up and there's something I don't want to do, no one's going to make me. I'm just going to put it off. And then you put it off and you put it off and it gets worse. And so here's part of my evidence, a case study for how to overcome procrastination. When the book came out, it was 25 years ago. I think about 20 years ago, I was on a radio show, and there was this delightful female radio host. And when I said, we procrastinate because we're lonely, she said, what do you mean? I said, what is something you're procrastinating about? She said, everybody says I should write a book. And I said, how long have you been procrastinating? She said, about 1.5 years. I said, if you were to write a book, when would be the best time to start writing it on your computer? She said, probably 7 a.m, write for half an hour each day. And I said, here's the deal. I'm going to call you every morning at 7 a.m. your time, 4 a.m. my time, middle of the night my time, for a month. I'm going to call you every morning, Monday through Friday, and I'm going to say, Natalie, get out of bed. No excuses. It's 4 a.m. my time. Get out of bed. Go on. Go over to your computer. Okay, you got it up. And then I will tell you, what is a question you want me to ask you that when you give me the answer, you start writing for 15 minutes, 30 minutes. And so we did that for a month. And she told her listeners, that crazy psychiatrist, he's actually doing it. He's calling me every morning. The guy's crazy. And we did that for a month. And then 6 months later, she calls me and she says, what's your address so I can mail you the book?
That's great.
Makes sense, kind of?
Yeah, that certainly makes sense. So that seems more of maybe loneliness might be substitution for lack of motivation, lack of outside encouragement, that type of loneliness. What about the case of procrastination where you're procrastinating by going out and hanging with all your friends or partying instead of studying, stuff like that?
Well, it's interesting because I'll give you just a little bit of neuroscience. Mm-hmm. When we're under stress, it releases a hormone called cortisol, a steroid. That basically prepares your body to get ready for the stress. Something else it does is when cortisol gets high, it triggers a part of your brain called the amygdala. And the amygdala is in your emotional brain, and it triggers something called an amygdala hijack. And what that means is the blood flow preferentially goes to your lower survival brain away from your upper thinking brain. So high cortisol triggers an amygdala hijack, and you can't think because you're in fight, flight, or freeze.
Mm-hmm.
Now, what people don't realize is that one of the things that counteracts high cortisol is, yes, you can do mindfulness, you can meditate. That will counteract it somewhat because those release endorphins. Endorphins are, it stands for endogenous morphine-like chemicals. So endorphins are your sense of well-being. So running increases endorphins, meditation increases endorphins, maybe even a little bit of dopamine, a little bit of pleasure. But connecting with other people increases oxytocin. And oxytocin is a hormone of connectedness. And it goes through the roof with young mothers, because when their infants are screaming and that mother hasn't slept for a day or two, instead of getting angry, the high oxytocin enables them to bond with that screaming infant. And so getting together with your friends increases the oxytocin. Feeling cared about increases the oxytocin. And when oxytocin goes up, cortisol goes down, the amygdala settles down, and your blood flow goes to your upper brain so you can start thinking.
Yeah, that's a great science-backed answer to that question. So, Dr. Goulston, thank you so much for your time. I'd like to close asking you what your advice is for young people in particular, but really anyone in maintaining good mental health, being a good active listener, just in general, finding success in their lives and their relationships.
Well, there's something that I've created. So I've co-authored 2 books during COVID. One is called Why Cope When You Can Heal, which I have somewhere. There it is. Why Cope When You Can Heal, How Healthcare Heroes of COVID-19 Can Recover from PTSD, co-authored with Diana Hendel. And a second one, that was in December of 2020. And this is the second one, Trauma to Triumph, a roadmap for leading through disruption and thriving on the other side. Again, co-authored with Diana Hendel. By the way, Diana Hendel was the CEO of a hospital where on her 100th day as CEO, an employee of the month came in and killed his 2 supervisors and himself. And she led the hospital back to financial and psychological profitability and soundness. So she was on my podcast, and I thought, I'm going to write these books with her because she is the kind of leader that the world needs. But in Why Cope When You Can Heal, getting back to your question, there's something that we talk about, and it's called the stress relief exercise and journal. So something that I did when I finally finished medical school, took me 6 years. Remember, I took 2 years off, is I started writing in a journal. And I wasn't a journalist, I was a doctor. And the first thing I wrote, the day I graduated, took me 6 years. The first thing I wrote was, I can't believe I finished. They have released a crazy person. And I'm now on volume, here's my latest volume. That was 1976. I'm now on volume 253.
Wow.
45,000 pages, 9 books, 1,200 articles, and apparently I'm a writer and an author. But what the stress relief exercise and journal is we have people think of someone who cares about them, living or dead. Could be a parent, could be a coach, could be an uncle, an aunt, a grandparent, or someone you don't even know. It could be LeBron James. It could be Steph Curry. It could be a hero that you think really cares about you. And so the way the exercise goes is you take a picture of that person, you put it on the inside flap of a journal, and on the opposite page, every time you get triggered, every time something upsets you, you imagine they're saying this to you. So I have a picture of Dean McNary in my journal, in my stress relief exercise and journal. And I imagine Dean McNary whenever I'm tweaked or I'm disappointed myself. I imagine him saying, Mark, you can do this. So I just remember him. And then he says, write down the date and time. Because it's a journal you keep track of. I write down the date and time. Then the next thing he says is, what happened? I write down what happened. Second thing he says to me, what'd you think when it happened? And then I said, I think, I probably should never be a guest on a podcast. I go on and on. I don't finish stories. I say, here are the 5 points, and I only cover 3 of them. I'm a real mess. And then the next step is, well, what'd you feel when you did that? Well, I feel like I'm really making it hard on these podcast hosts. And then he would, then Dean McNary would say, after that, well, take a deep breath. What would be a better thing to do? So it's like the date and the time, what just happened? What'd you think when it happened? What'd you feel when it happened? Oh, the next thing is, what does it make you want to do? Makes me want to just, never do another podcast again. And then after that, it's take a deep breath, Mark. What would be a better thing to do? And in this case, what my deceased mentors would say is, so what'd the host think? And I say, they want me back again. And then my deceased mentors say, Mark, you can do this. Put a sock in it. I love you, and let me go rest in peace. But do you follow me? It's like calling upon someone to walk you through it, living or dead. And what that does is it releases oxytocin.
So it makes it seem like you're not just telling yourself what to do, but that you're forging a social relationship, or that you're receiving encouragement.
Right. When I hear Warren Bennis talking me down, I just remember him. I miss him. I think, boy, was I lucky that someone like Warren Bennis made time in his life for me. And so I cross over into feeling appreciation, gratitude. And I have something called the Dead Mentor Society. I have now 8 mentors, and they're all gone. But I feel this oxytocin. But that's what works for me. Because as I said, I believe for me, at my core, is it's feeling alone in all those awful feelings, feeling unpaired. And so I would just say, try that.
Mm-hmm. Think of someone. Journaling practice. Yes. Is it most beneficial in the moment? Like it's just you do it, you feel better, and you move on, or do you make a habit of going back and going through your old journals?
I have. Here's a crazy admission. I have 253 volumes, 45,000 pages, and I can't read my writing because I'm a doctor. But what happens is anything that's important. So my journals are not just talking me back off a ledge. It's I write down stuff that I want to think about later. And it's a way of saying, and if you keep a journal, it's a way of you saying, if I thought it, if I felt it, it doesn't matter what anyone else says about it. It was at least worth writing down. So for me, what happens is beyond using it as a stress relief exercise and journal, I just write down things that I want to think about at another time. And then the more that I keep writing about things that I want to think more about, that becomes an article, or maybe it becomes a book. Mm-hmm. And so I use it that way. But I hope what people are getting at, it's when you can use the love that people living or dead and the belief in you that you don't have to talk you through something, it may just help you get through the moment. So in answer to your question, I would say, yes, use it in the moment, because that's when you're most likely to act on an impulse that you're going to regret.
Mm-hmm. And people with depression can have a habit of spiraling into these thoughts of no one actually cares about me. So I could imagine that in a low point, trying to do this exercise, thoughts like this person really doesn't care, or why am I even doing this, stuff like that. How do you combat those types of thoughts?
Well, I think what you want to do is especially when you spiral. Now, if you've spiraled and you've come out of it, because most people cycle, I think it's important to make a note to yourself that when you're feeling a little bit better, you can actually reevaluate that people do care, or people who have died cared about you. And I think it's important for you to do sort of a mental check that when you're feeling down and you think nobody cares or ever cared about me, that that's really being colored by the depression.
Mm-hmm. And are you contrasting those thoughts, like you know, the ones that you feel when you're down, and the more rational ones, or should you just try and ignore the bad thoughts? Because I've wondered when you're journaling, if you're thinking bad thoughts, that it might actually make it worse to write them down, because then you're sort of validating them. But is that not the case?
Well, I think it depends for whoever the individual is. Sometimes when someone has the bad thought and they get it out, just the writing actually gets it up and out. I mean, there are some therapies that have you write your bad thoughts and then burn them, throw the pieces of paper away. So I think whatever works for you. But I really would urge people to, when you're feeling alone and those bad thoughts and worthless, to just think of anyone from your life who cared about you. I mean, here's the power of it. So that Dean McNary, I think he saved my life. He was probably my first mentor. Mm-hmm. And that's why I have a picture of him in my journal. In terms of and it changed my life forever. For 25 years, I was a suicide prevention specialist. I'm now retired status. I teach it around the world. But I would say, because when I was depressed, I didn't want to burden people. I would say the total FaceTime I had with him, my whole relationship with him, including 10 years later when we went out for coffee, after I finished my psychiatry training, I'd say I had less than 2 hours of FaceTime with him total in my life. But when, they say when the student is ready, the teacher appears. Well, I think when your hopelessness is open to surrendering, the angel appears. I'm not religious, but I look at Dean McNary as an angel who was sent to my life to save it. And as I've checked in with my medical school, apparently I wasn't the only one.
All right, that's a great place to stop. Dr. Goulston, thank you so much for your time. I'll link your website in the description. Be sure to check out the My Wakeup Call podcast. And thank you very much.
Thank you for having me, Andy.
A quick appendage to this episode with Dr. Mark Goulston. Dr. Goulston mistakenly referred to me as Andy, not Adam, a couple of times towards the end of the episode. And this didn't bother me, so I let it slide. But Dr. Goulston, after we finished recording, noticed and apologized for his error, and advised me and others in similar situations not to be afraid to respectfully speak up and correct the person's error. So Dr. Goulston, thank you for your correction and for your advice, and it was great having you on Race Cockatons.